Welcome to the Libido Lounge, where we focus on all things love, lust, and libido. We believe that fabulous sex is important to health as exercise and good food. Hey, everybody. Welcome back to another episode on The Lounge. I'm your host, libido expert, Dr. Diane, and I am so excited about the conversation that we are having today with dietitian Ashley Koff. We're going to have the best time. We're going to talk about all sorts of reasons for low libido and some of these that you have not heard yet on this particular show. So we're going to talk about additional hormones that you need to know about. We're going to talk about the relationship of these new hormones that you probably have never heard of to things like blood sugar and your vasculature, your blood vessels, all these different things from a physical standpoint that are really rooted into driving low libido, as well as driving a lot of other health-related types of conditions. So welcome to the lounge, Ashley. It's so great to have you with me today.
Thank you. I just wish I was laying on your couch. This feels like, let me come on in and lounge.
Someday we're going to do this in person and we'll have everybody over. We're going to have wine. It's a whole part of the vision. So we will get there. We'll invite you back for that.
Thank you.
Let's get right in. So I want to talk about the hormone incretin and the hormone family incretins. So let's kind of introduce that, because I know a lot of listeners are probably hearing that word incretin and have like never heard this before. And how does this relate to them? What is this? How are these hormones related to libido? Can you kind of set the stage with what these hormones are and why people should really be thinking about these in terms of their health and libido?
Yeah. So I probably wouldn't I definitely don't think a lot of people are hearing incretin or incretin in that space. It depends on the podcast you're listening to or how people are talking to you. I'm hopeful that we will start to be hearing that more often. But we're definitely hearing Zepbound, Zepi, Ozempic, tirzepatide, Mounjaro, and these medications, they actually are based off of a hormone. So these medications that have been around since like 1995, that were originally studied for Alzheimer's, that are now being used for metabolic health, blood sugar, and then definitely where we're hearing about them in weight health, are creating awareness about a hormone that's actually really important for you to understand in your total libido picture. So that's the journey that I hope, that we can go on today, where when you think about or when you hear about those hormones, whatever, medications, et cetera, whatever you're thinking, I want you to have that moment of, oh, that's right. This is why I'm doing what I'm doing to make sure that I'm optimizing my hormone for those libido outcomes. So the reason it's important is that those medications are a synthetic, accelerated, or intensified version of a hormone that our body, or type of hormones that our body make in the lining of our digestive tract. So just like you could take insulin, you could take testosterone, you could use an estrogen or progesterone patch, you can now get synthetic GLP-1. But the natural GLP-1 in the lining of your digestive tract plays a really important role. It's a switch. It flips it on. And when it flips things on, it turns you on. So we're going to talk about the benefits of being turned on. Two of those benefits are, from this hormone standpoint, are to, number one, have better appetite, control. I hate to use the word control, but just have a better sort of appetite system, if you will. So you feel satisfied with what you're consuming. That's the leptin hormone. And the other one is your blood sugar hormone, where we look at insulin in that part. And where we're going to go in this journey is to help you understand why that's important for libido. So really good for you to just know, when you hear Ozempic, think GLP-1, and remember that Ashley Koff said to you that that's actually a hormone that you make in your body, in the lining of your digestive tract, that has to do with your libido as well as other aspects of metabolic health. So it's a bigger answer, but I just wanted to kind of trace the journey there.
Yeah, thank you. And I want to make sure I'm summarizing this for people, because I know there's people that have heard of these words before. And then I know some of our listeners are like, what are all these things that are being said here? So to trace this journey back, just to make sure that I'm following and tracking you okay, and that our audience is. So essentially you're saying that GLP-1 is made in the gastrointestinal lining, right? And then and the GLP-1s are going to, is leptin a GLP-1? Is that a type of GLP-1?
No, great question. So GLP-1 is a peptide. It's called glucagon-like peptide. So it is a hormone, and it is a hormone whose sole job, it literally sticks around for 30 seconds, right? So its job is to turn on two other hormones that we know of. Well, there may be other things, but that's leptin and also insulin. And so those hormones we may have heard more about, leptin and ghrelin as they are related to appetite and satiety, and then insulin and glucagon as they're related to your blood sugar.
Okay, perfect. And then all of these other pharmaceuticals that you are naming off, are those different types of GLP-1s? Is that what those are? Okay.
Correct. Yes. And some of them, without getting too into the weeds, some of them are GLP-1 alone, and some of them are GLP-1 and GIP. We don't need alphabet soup on that part. You just want to know that they're the synthetic version of that hormone. Yeah.
Okay. And I think this is great too, because I know like in the weight loss world, right, GLP is getting so much press all of a sudden, right? So now, just helping people understand that this is something that we actually do create ourselves, and that is actually controlling things like our leptin, like our insulin. So then let's go on from there. So can you help us understand then how leptin and insulin really are related to libido?
Sure. And this is where I was so excited to connect with you, because I love your podcast for making it very much easier for people to both normalize the conversation around libido and also understand where they may want to explore. Because our libido is multifaceted, as you talk about. So there are things that when we have hormonal disruptions, not our sex hormones, but our metabolic health hormones or our appetite hormones is what I'm going to call leptin and ghrelin on that part, that are going to affect our libido. I could be as blatant as, if my leptin, if I don't feel satisfied with what I'm eating and I overeat, then I may feel just like overfull. And my body's response is to completely move me away from libido, because I just don't feel either physically good about my body or emotionally good about my body. When we feel full, it's a little like, and especially overfull, it's a little hard to feel groovy, right? Like on that part. Okay. So there's that side of it. And on the flip side, if we feel over hungry, right? If we feel unsatisfied, I haven't gotten what I need, then I can also be experiencing a space where that's impacting my libido. I work with and over the years, I've worked with a lot of entertainers and professional athletes. And you'd be really interested to know that actually, so we use libido as a health marker, which is also why I love your podcast. It's so fun on that part. I do really think that when your libido starts to be off, or if you notice there's a particular time, and one of the times that libido can be really affected is when you're performing in another capacity in a very intense space. So that could be like any of us, where if we're performing as a parent, if we're performing at work, if things are very stressful, and that kind of thing. And so we've actually looked at libido there. And one of the things that we actually noticed is that when people are undernourished, that they're feeling hungry, that the right nutrient balance hasn't happened, that their satiety hasn't been hit, or maybe their genetic design is that it's harder for them to feel satisfied. That's that leptin resistance. Then that can actually be affecting their libido. And you're the expert there. We can, definitely dive deeper into it. But that's one of the reasons that this GLP-1 hormone is really important, because another reason that if your body isn't producing GLP-1, so say that I'm somebody, and this is true, I took a lot of antibiotics as a kid, or maybe I was diagnosed as celiac later, and went through a period of time where I had stomach irritation, or maybe I've either chosen to take birth control, oral contraceptives, or I've had to take steroid medications, or maybe I have ulcerative colitis or IBS or SIBO. Any of these things will be affecting the lining of the digestive tract, which will affect the production of GLP-1, which, if we stick with me, will affect leptin being turned on. So again, I may overeat, or I may not feel satisfied by what I'm eating. And as a result, that can directly affect my libido. So one of the things I wanted us to take away from today is, if you are someone where you're experiencing either a history of digestive, or currently things are digestively not feeling like they're good on that part, or you're just kind of like, I always feel hungry, even if I eat, and then right after eating, or I eat an amount that somebody says is like better for me, or I should be full with that amount, and I'm not experiencing that, we may want to explore your natural production of GLP-1. And the upside of optimizing that is actually going to be to make it easier for you to support healthy libido. So that's that whole circle, and that's just the one side. I'll get to blood sugar in a second, but anything around that appetite piece that you feel like, sort of from what you've explored or kind of how you think about libido or that poses a question for you.
Yeah, one of the things I think that people might be wondering, so like what I'm tracking here for people is, okay, well, how, what kind of things are going to cause GLP to be low, right? So some of those examples you gave around chronic digestive things, antibiotic use, like those are some of our causes, right? So we want to fix the gut, we want to fix the microbiome in that scenario. Is there, from a standpoint of like, we know we can test leptin and blood work, we know we can test insulin, fasting insulin and blood work. Is there a reliable test for GLP, or do we more have to kind of extrapolate that based upon, hey, what leptin and insulin levels are doing?
Yeah, I love that you asked. Remember, I described it as it's about 30 seconds, right? So it is a quick shot on that part. There are a lot of jokes that come to mind for me right now, but it just flips on like a light switch. That's right, exactly. Yeah, I'm the daughter of a urologist, so I'm so used to them on that. So in that space, there actually isn't because of that. So we tested in labs because you can, somebody's forced to be sitting there, or we're using lab animals, or looking at cells on that part. To date, so as the time of recording this, there isn't anything that I would feel comfortable saying to use. And so that's why we've looked at a variety of these different symptoms. And it's actually why one of the things that I look at with libido, again, as a marker of health, just like I love fertility as a marker of health, is to come back to, hey, if we're working to optimize your libido, let's ask those questions about your appetite, your satiety as a part of your overall digestive health evaluation so that we can understand, because the other pieces are things like alcohol. So if we drink alcohol, that's going to increase the inflammation around that lining of the digestive tract, right? Stress, I mentioned before, immune health, or if you have an autoimmune disease like that. So there are a number of factors. We put together a free quiz that I can direct people to, just to ask the question, do I need to be optimizing my GLP-1? And so we can kind of ask those questions. And then, as you mentioned, we can also start to trace to what would be the best way for us to assess where you are, and then set goals so that I always like to have a goal plan for our treatment, on that part. But there isn't a reliable measure. Yeah.
Okay, that's helpful. And can we put the quiz for that in our show notes here?
Absolutely. Yep.
Okay,
exactly.
awesome. So everybody, we'll make sure we get that in the show notes for you as far as how to analyze that. And let's move on now to the insulin component and the blood sugar component. And we've talked already in various episodes on this podcast around blood sugar and its impact on libido, or even blood sugar's impact when it's too high for too long on the vessels, and that leading to low libido as far as low blood flow, right? Yeah. But let's also bring in, so how can you talk more about how is that related to the GLP, the insulin, as well as can you tie in any hormone relationship there as well for us?
Yeah, absolutely. So insulin resistance often occurs, or one factor that can be, one of the things that can be a factor in insulin resistance is what we'll call blood sugar dysregulation. So that can be highs and lows. It could be a period where it's very high. I usually say peaks and valleys versus rolling hills, but you could still have rolling hills just above where we want you to be. So if your rolling hills are in, say, the 120 to 150 space, rolling hills being better than peaks and valleys, but I still want it to come down to that sort of 70 to 110 range. So it's really important for us to understand just insulin and the insulin response in a whole picture of metabolic health, because it is going to be that thing that we look at, that has such a play with cognitive function. And so we know a big part of libido is also related to cognitive, maybe a little bit more with women than with men, when we see that piece, but it still is something that we do, sort of need to be able to explore on that part. So one of the things, again, going back to our GLP-1 is one of the incretin hormones, and it's produced in the lining of the digestive tract. And its role there is to actually turn on, to flip the switch in the presence of carbohydrate and fat primarily, to say, oh, that's there. So now I'm going to send insulin out. So for a long time, we've just been focused on the insulin side of things, and saying to people, let's give you insulin, or let's work on ways to improve your insulin. Let's mimic insulin, even with things like cinnamon, and, making sure that we've got enough chromium in our diet so that the cells can bring the insulin in. But we haven't been paying attention to what actually yells out the window and says, hey, insulin, time for you to go. That's the GLP-1 hormone. So if you go back to all of the other episodes where there have been those different pieces where we've looked at insulin, that's just going to be a great reminder for you to say that, especially too, if you feel like, I get this all the time where people have, feel like I've been working on my diet, I've taken those supplements, I'm doing these, I'm exercising after I eat, kind of trying all of these things, and they feel like they're not seeing better blood sugar results. And there might be two different things that they might be looking at an A1C, which I tend to not like to look at. I like to look at a fasting insulin, and I like to look at continuous glucose monitoring to see where, in your day or in your evening, this could be a factor while you're sleeping. But now we know there's a third area, which really, we've kind of been, you and I, the type of practitioners we are, we've been talking about this because it's your digestive health. And even beyond it being the digestive health, not just the microbiome, but it is very much the lining of the digestive tract. And that, when we look at the lining, when we look at the mucosal layer, we have to think that this is where nutrients are absorbed. This is where our immune response is deployed. So there's a lot of hormonal interaction, thyroid interaction, vitamin D, which I consider a hormone, is going to be a factor. Things that I know you've talked about in other episodes. I'm not going to, beat them over the head. But what's really also interesting is when this is often packaged together. So insulin is often packaged together in something we call metabolic syndrome, where we look at blood pressure and we look at risk of heart disease. So we look at heart health, and then we look at insulin and our blood sugar. And when we look at that in totality, we really need to understand that we've got to be in this space of optimizing all of these. So we want to look at, what's better for my blood sugar is also needs to be better for my the vessels, the blood vessels, that we've talked about on that part. You can't have sugar in those tiny little capillaries blocking things up where blood is supposed to flow, or we're not going to get responses as quickly, as we'd like them to. We talk about that in our eyes and our kidneys, but we need to talk about those in areas where we're trying to get the response, for libido. So that's going to be really important. And then the other piece that's important is when we want to really be focused on interventions, when your digestion is not better, it can often throw off hormones, testosterone, estrogen, progesterone, et cetera. We've talked about thyroid, vitamin D, but also when those hormones are not better, they can throw digestion off course. So one of the things that I often see is that when somebody's being treated for ED or treated for low estrogen or adding in progesterone and kind of, or trying to navigate or even DHEA and cortisol and these sorts of things, if you don't focus on the GLP-1 and the digestive restorative part, you're probably missing a piece that is going to bring this all together. So what I want us to do is, I'm old, so I think of that Trivial Pursuit where it had all the different colored pie pieces.
Oh, yeah.
And we just want to remember that one of those colored pies is GLP-1, and we haven't been in that space. So I have people who are, dealing with ED, and they may be doing, focusing on testosterone, and they're trying to get in protein, and they're, exercising. Maybe they're even eating an anti-inflammatory diet, but we haven't done the repair work and the focused work on the GLP-1 side, and it's not all coming together optimally. So that's kind of how it all ties together. That was a mouthful, but does give you some indication there. Yeah.
Oh, it's so perfect. It's so perfect. I think it's we've covered so much today, and I think it allows people to really come back to one of the points that you started with, which is, like you said, we have a mutual feeling of this of low libido it's a symptom, right? It's a symptom
Right.
of an imbalance. And,
Yeah.
so I hope everybody is really taking this away, that, the imbalances could be, blood sugar, cardiovascular, as well as gastrointestinal, but also really taking this first step, because I think a missing link that a lot of people are not talking about yet is this GLP. So I really hope that everybody will go and take your GLP quiz. Is there anything else you want everybody, as we wrap up here, to know about how to get a hold of you?
I don't think so. We're over at the Better Nutrition Program with the goal of being able to complement whatever you're doing with your other practitioners, but to be able to come in. Sometimes it's just support that you need to figure out how to do the recommendations, that they're recommending, or sometimes there's a missing piece, as we were talking about. And based on the quiz, we actually give you some targeted next steps. And if you ever have any questions, we also really try to just have a human response. So you can just chat us and see, hey, where do I go from here? There was one final piece. I do think it's really important that we maintain a differentiation between GLP-1, the hormone in your body, and the GLP-1 medications. We are hearing there is definitely not enough research in the weight loss space around the medications to understand if there are side effects to libido and to sexual performance. But if you are deciding to go down that path, or if you are on one of those medications and you're seeing results, then we know your natural GLP-1 needs to be optimized. So you're still going to benefit from this approach, probably as a way of reducing side effects, associated with it. And the main thing is talk to your practitioner if you're on one of those medications, and have a plan from the start of tracking your libido as one of the factors that's included there, so that you aren't surprised 6 months later with my libido's in the toilet kind of thing, or it's tremendously accelerated, which may feel like a win, but also could metabolically mean other things. So I do think that's an important distinction. Yeah.
I appreciate that as well. And also just a reminder to everybody to, go back and always figure out those root causes, right? So it's like, if you take your quiz, if they go and take your quiz and come up like, oh, GLP is low, likely, then it's like, well, why? And just always as a reminder, just going back to the whys. And I want to thank you so much for being on the lounge with me today. And I want to remind all of our listeners here that at the end of the year, we are inviting the top few people that had the highest performing shows back for a longer episode. So if you're super excited about this conversation with Ashley, like I am, make sure you download, you share it to your friends. Don't keep us a secret, because that will position her to come back and be able to answer more of your questions and spend more time with us. So thank you again for listening. Remember that you can always find me at my Libido Doc and take my own quiz, Libido Quiz. Please make sure you go take the GPL quiz that's in the show notes from Ashley. And this is Dr. Diane here, reminding you to always stay classy, always stay sexy, and always remember to be a little badassy. We'll see you next time.
Thank you for listening to the Libido Lounge. Please don't keep me a secret. Please share this with your friends. You can find me on YouTube, on Instagram, as well as how to work with me at mylibidodoc.com.